You're listening to OET Roleplay Practice with Kev, the English native.
Hello, it's Kevin here. Time for another OET Roleplay for nursing. This is from OET Roleplay card number 5 from OET.com. This is one about the patient coming in for stitch removal, and they're a bit anxious about the possibility of skin cancer. So this is a very good example of your empathetic and reassuring skills. So, as always, you can use the audio to shadow, to practice your pronunciation if you need be. There's a link to the annotated transcript where you can see how all the phrases are mapped to the clinical communication criteria. So you can take a look at that while you listen along. So you can practice that, use it to shadow, practice those lines. I've explained this in other videos, episodes, and on my website, theenglishnative.com, and on LinkedIn as well. Links below if you're listening on Spotify. And I'm going to be making a video, I don't know, today, if I get time, explaining how you can use the audios here on Spotify with an AI partner such as ChatGPT or Grok to actually practice your roleplay speaking. Now, the only thing about it is you have to have the paid or pro version. So, but you can subscribe for a month, then cancel. And I think for ChatGPT it's about $18 maybe, not sure, $18, 18 euros. So it's not excessive, but as I'll show you in the video I'm hopefully going to make today, you can see how using these audio files here in conjunction with chat and then recording your answers and sending me the audio for my analysis, it's a good way to improve your OET speaking. So have a listen. Have a listen to the phrasing that the nurse uses to reassure this possibly anxious patient. And let's see how it goes.
Hello, my name's Evelyn. I'm one of the nurses here at the clinic. Could I just confirm your name, please?
Hello, nurse. I'm Kevin Dean.
Thank you, Kevin. Nice to see you today. Before we begin, let me check. The reason I'm seeing you today is to check on the wound on your hand and to remove the stitches that were put in after your recent procedure. Is that right? And while we're here, we'll also do a quick clean and redress of the area to make sure everything's staying protected.
Yes, the doctor told me to come in today and that someone would take the stitches out for me.
That's exactly right, Kevin. We'll get those stitches out safely and I'll make sure the wound is healing nicely. So, before we get started, how have you been feeling since the surgery overall? Is there anything on your mind or any concerns you'd like to chat about before we continue?
Well, actually, nurse, the doctor told me I had something called squamous cell carcinoma. I think that's just another name for skin cancer. And to be honest, I've been a bit worried about it.
I completely understand why that would worry you, Kevin. It's a big word, and it's normal to feel a bit anxious when you hear it for the first time. Let's talk through it together so I can help ease some of that. Squamous cell carcinoma is indeed a type of skin cancer, and it's one of the more common ones, often linked to overexposure to the sun's ultraviolet radiation over time. The good news, and this is really important, is that it's highly treatable, especially when caught early, like in your case. The surgery we did removed the entire lesion, so the cancer cells are gone from that spot, and it's very unlikely to have spread anywhere else. Does hearing that help put your mind a little more at ease?
That does make me feel a bit better, thank you. But I keep wondering, will I need more surgery in the future if other spots appear? Like, how do I know if this is just the start of something bigger?
I appreciate you sharing that concern. Unfortunately, I can't give you a definitive answer on future surgeries because that really depends on your individual situation, and your doctor is the best person to discuss it with in detail during your follow-up appointment. The key right now is regular skin monitoring. Things like checking your skin monthly for any new or changing spots, moles that look different, or anything unusual. And sticking to those scheduled checkups with your doctor will catch anything early. How does that sound for you?
I understand, nurse. I'll keep that in mind.
Great. Now, since sun exposure played a role in this, can I ask what you usually do to protect your skin when you're out in the sun these days? Like sunscreen, clothing, or anything else?
I always use a high factor sunscreen, 30 or higher, and I wear a hat when I'm out. But honestly, I think it's too late for me. I spent far too much time in the sun when I was a teenager. Beach days, no protection, you name it. So I feel like the damage is already done.
Well, it's completely valid to feel that way, especially after something like this. But here's the reassuring part. It's absolutely not too late. The steps you're taking now, like the sunscreen and hat, are making a real difference in preventing further damage and reducing your risk of new issues in the future. Does that make sense?
Actually, yes, nurse. Thanks for that.
Very good. Now, before I remove your stitches, can I just check how the wound has been healing since the surgery? Have you noticed any pain, redness, swelling, or discharge at all? Or anything else that's felt off?
No, it's been fine overall. No pain or discharge, and it doesn't look too red, but I still think it feels a bit early to have the stitches out. I mean, it's only been about 10 days, right? What if it reopens or something?
That's a fair concern, Kevin. Let me explain why we're doing it now. Stitches are typically removed between 7 and 14 days post-surgery, based on how well the wound is healing and the doctor's assessment. In your case, from what I can see, the edges are coming together nicely, with no signs of infection, so taking them out today will actually promote better healing by letting the skin breathe and reduce any scarring risk. We've waited just the right amount of time to ensure it's strong enough. Does that help address your hesitation?
Yes, I suppose so. It does feel reassuring hearing the timeline like that.
Wonderful. After I remove them, I'll clean the area gently with saline, apply a fresh dressing, and we'll be all set. For aftercare at home, keep the wound clean by washing with mild soap and water, pat it dry, don't rub, and cover it with a sterile bandage until the scab forms. Avoid soaking it in baths or pools for a week, and if you notice any increasing redness, swelling, warmth, pus, or fever, give us a call right away so we can check it out. Sounds straightforward?
That makes sense. I'll follow that to the letter.
Perfect. Just so you know, the procedure itself is quick and straightforward, usually just a few minutes. You might feel a gentle tugging as I cut and pull each stitch, but it shouldn't hurt. If it does, just let me know, and I'll pause. I'm right here with you. Do I have your consent to go ahead with the removal now?
Yes, you do. Thank you for explaining everything so clearly. It's made me feel much more at ease.
You're very welcome, Kevin. I'll go ahead now, and we'll have you comfortable in just a few minutes.
So, not too bad, not too bad. You can hear, and I wrote the script to try and be as empathetic as possible. You can see how the key thing here is for the nurse not to simply dismiss the patient's concerns. Okay, I understand, without going into it. As I keep saying, you should never miss an opportunity to explore based on the cues the interlocutor or patient is presenting you with. Yeah. So if they say, "Oh, I'm a bit concerned about this possibility, is it cancer?" Don't simply say, "Okay, I understand," then move on to something else. That's not empathy. So I hope that gave you some good ideas. Like I say, links below. I'll put the links to my newsletter on LinkedIn. You can subscribe. You can read all my articles about OET speaking, etc. If you need lessons, you can contact me on italki. There's a link for that as well. So I'll put my LinkedIn link. Add me there if you wish. italki, my YouTube channel as well. So, which is mainly for OET for writing, but that may be of use to you. So, there you go. So let me see. I've done 5 medicine ones. This is a 5th form nursing. This week I'm going to definitely do 6 roleplay card 6 for both medicine and nursing. So keep an eye out for those, and you'll hear me soon. Okay, bye for now.
Thanks for listening to OET Roleplay Practice with the English Native. Join me next time for more practice and tips.